Welcome to the presentation on difficult airway. This is an algorithm or decision tree that you can use. It's similar to one that's in our textbook on page 353. Some of the elements in the algorithm in the book have been compressed here. You start by assessing the amount of airway assistance you have available to you. This can help you decide if you have enough hands, enough personnel, enough stuff in order to maintain the airway that becomes complicated. If the patient's condition is such that you are forced to take some action to maintain the airway, you'll have to then decide what level and type of action you're going to take. If the airway is not compromised, then you can maintain the patient using basic life support procedures like oxygen. If this maintains the patient, then you can just transport. If the patient presents a greater risk, then you might have to deliver a more advanced basic care like a bag valve mask or an extraglottic device, and you can still transport. If the risk is even greater, consider something more than just the bag valve mask and the extraglottic device. Perhaps the patient will need nasotracheal intubation. If you're forced to act, consider performing rapid sequence intubation. If that is successful, then you'll simply need to perform post-intubation care, like reassessing to be sure the tube is still in place, that the patient is adequately oxygenating and not retaining too much carbon dioxide. If BLS measures don't maintain the patient and the airway is significantly compromised, then you should consider either an extraglottic device or perhaps cricothyrotomy. If there is not any significant airway risk, go ahead and transport the patient with routine and continual reevaluations of the airway. If bag valve mask or extraglottic device is not sufficient, then ask yourself whether or not you need to perform RSI. If RSI cannot be done, perhaps you'll need to do nasotracheal intubation. If it can be done, go ahead and perform the RSI if it's called for. If it is not available to you, then consider the cricothyrotomy. In this scenario, you have a conscious and alert patient. The patient complains of increasing dyspnea or difficulty breathing. She has a history of asthma. Respirations are 18 with noted wheezing. Pulse is 100 and regular, easily palpable at the radii. Skin is warm and dry. Pupils are equal and reactive to light, and blood pressure is 130/76. Take a moment and consider these vital signs before we move forward.